Hi, my name's Greg Fell. I'm the Director of Public Health for Sheffield, and I'll just take 2 or 3 minutes to talk to you about the key messages from this year's report. I've focused this year on the economy and the links between the economy and a healthy population. And I suppose the first thing to say is that people think of the economy as what business is and what private businesses thinks and does. And the way I'm framing it is that everything is the economy. Everything that happens in Sheffield is in the economy. It's not just what private business thinks and does, but it's the public sector, the private sector, the voluntary and community sector, i.e. everything's in. And that changes the way that we think about the economy. And if people like me talk about the determinants of health, well, the economy is perhaps the determinant of health. So the key thing for me is a healthy population. There's a two-way relationship between a healthy population and a wealthy population. Health equals wealth, wealth equals health. And just as HS2 is an important infrastructure investment in the economy, so is a healthy population, and that's one of the key messages from this year. However, many people are left behind, and we know that. I've commented on that before, many others have commented on that. We know that in some parts of town you could expect to get to about 45 or 50 before you start becoming poorly. In other parts of town you can expect 65 to 70 years in good health. That represents a lot of lost years, both in terms of poor health, but also economic productivity of the economy. So I guess the key central message for this year is pushing harder and faster on the concept of inclusive growth. The economy's grown, but people have been left behind as the economy has grown. So the key principle underpinning inclusive growth is that nobody's left behind, and that the proceeds of growth are shared equitably across the whole of the population of Sheffield. Easy to say, quite hard to actually do in practice. So one of the things that I'm proposing is that we redefine what growth is. Traditionally, if you talk to an economist about growth, they'll talk about GVA, or gross value added, which is the classic traditional measure of how well or not the economy is growing. I propose that we use a broader measure of growth that includes a range of social indicators reflecting the fact that everything's in with regard to the economy. So second key message is jobs. Perhaps the most important thing we can do for our health is have a job, or have some kind of meaningful activity. Doesn't necessarily need to be a paid job, though sometimes the money does help. But having a role, having an occupation gives us a status and a purpose in life. But good jobs are important, and one of the things that many people are commenting on is the gig economy and the growth of the gig economy. So I don't know the numbers, but there are many people within Sheffield who are within what you'd call the gig economy, that live on 0 hours contracts, low paid work. They don't get the same security, they don't get the same protections, sometimes they don't get the same wages as those who are in the employed economy. So there's some smart thinking to be done about if the gig economy is part of the economy, we need to internalize what's the externality there, and think about everything being in, back to the central message. So clearly Sheffield started down this path. Just last week the Sheffield Partnership Board launched its inclusive growth framework, which is a framework for all sectors of the economy to think hard what their contribution is to making sure everybody can benefit from the proceeds of economic growth. It's a fabulous start, but there's clearly a lot more to do to make it real. One of the things that I'm recommending and will push on quite hard for the next year or two is the notion of economic anchors. So at city level, there are a number of very large institutions, the council, the 2 universities, the various NHS institutions. They act as anchors for, or economic anchors for the people of Sheffield, and what they do with regard to their investment decisions, their employment decisions, their workforce training and HR decisions has an impact on the economy. And equally at local level, the anchors are the library, the GP surgery, the community pharmacy, the sports and leisure centre. And again, what happens at those levels is important and can have an impact on economic growth. So what the critical thing is to make inclusive growth real to the people in Tinsley or the people in Darnall or the people in Parsons Cross, and I think we all accept that's not easy, but that's why we're pushing quite hard on this, and we'll push quite hard on it for the next year or two. Some practicals, I would encourage everybody to sign up to the Fair Employer Charter. It exists, it's a locally grown, locally owned product, and I think all employers in Sheffield should sign up to the Fair Employer Charter. What about signing up to the Foundation Living Wage? Do all of our big institutions really think hard about what they're doing with regard to social value around their investment decisions or their skills and their recruitment and their training agenda? So the key message for me is aligning the economy bit of economic growth with the inclusive bit of economic growth. And that's clearly where I'll be pushing over the next year or two, and my recommendations in this year's report are in that mould.